Good afternoon, ladies and gentlemen. Thank you for being here, as ever. Happy Monday to you. I'm sure you were able to hear the President's remarks a little earlier about the Affordable Care Act.
5 days before the launch, the President said it's a website where you can compare and purchase affordable health care plans the same way you shop for a plane ticket on Kayak. Who misled him? Who misled the President on this? Are you telling me 5 days before that somebody let the President go out to the American public to give this speech and say this and make this promise? In fact, the next line is, I promise you, this is a lot easier. It's like booking a hotel or a plane ticket. Who let him down?
We're focused on making improvements so that the millions of Americans who want affordable health insurance are getting the best consumer experience possible, as opposed to Monday morning quarterbacking.
What
I'll tell you is, as I mentioned earlier, I think, is that there's no question that the volumes exceeded substantially expectations, and that the testing that was done was based on...
Adding a server would have fixed it in a heartbeat.
Well,
that
again, I don't think...
Right?
I'm pretty confident you're not a...
I'm not a computer scientist, but
you haven't written code in your day. But
if this were simply...
As I said earlier, is that the volume far exceeded expectations, and that the volume both created problems because of how large it was, and exposed other problems and glitches and kinks with the system that are being addressed.
Why shouldn't we assume, when HHS puts out in this blog post last night, that they brought in this tech surge, brought in people on the outside? That seems to send the message they don't know what the problem is. Is that fair? I mean, should we not assume that?
No, I think you should assume that they identified problems and glitches that need to be fixed, and that they brought in this team to continue the effort.
Wouldn't you be screaming up and down?
I think we are finding problems, and we're working on solutions. I can't, the part of when you have tech experts at any major tech operation, you're constantly monitoring your operations.
Are you open to extending open enrollment? This is a separate sort of follow-up to the question about considering that this is now going to potentially be a lost month in open enrollment. Are you guys open to extending open enrollment an extra month?
Well, I'd say a couple of things. One, I'm not sure how you can call a 3-week period or even a month a lost month when there have been hundreds of thousands of people who have submitted applications. And that's not just your name and your website, your email address. That's the application that much of you discussed and we've talked about here, that was initially 21 pages, but is now down to 3 pages to make it an easier experience for consumers. Thank you all very much. Have a great day.